Hi, my name is Dr. Stephen Michael Humphrey, and I am a physician at Vein Clinics of America in Brookfield, Wisconsin. Before joining Vein Clinics of America, I worked as an interventional radiologist while serving as president and CEO of Radiology Specialists in Milwaukee. I'm a board-certified physician in diagnostic and interventional radiology. I joined VCA in 2014 after spending the first 13 years of my career working in an inpatient hospital interventional radiology practice. In my previous position, I was the president of a large radiology group and spent most of my days caring for inpatients, often only seeing the patients once. It was difficult to form a strong patient relationship. After joining Vein Clinics of America, which is entirely outpatient, I've enjoyed the increase in time spent with patients and watching their health improve from our various treatments. The VCA family encompasses over 60 clinics with quality physicians from all fields of medicine. This gives us a major advantage over other healthcare entities because now we can share our questions or ideas with our entire doctor group and get an answer almost immediately. Things like using someone's prior experience to navigate through some complicated anatomy or seeing a patient with an unfamiliar rash, medical problem, or medication. When you have such a diverse group of physicians, almost no question goes unanswered. The care that patients receive at Vein Clinics of America for their varicose and venous disease is of the highest quality. Each of the physicians must demonstrate a standard of care that meets VCA's quality control requirements. This is in combination with specially trained physician extenders, nurses, ultrasound technologists, and office staff, allows Vein Clinics of America to stand out amongst its peers. After patients meet for a complete history, physical, and obtaining a full diagnostic ultrasound evaluation of their legs, I'll come up with a customized treatment plan, which meets each patient's specific needs. With the latest improvements in ablation technology, these treatments can be performed with minimal to no discomfort. And the best part, most people continue their usual work and exercise schedule. Because we use a minimally invasive approach, patients will usually have less bruising and discomfort afterwards. This, along with significant improvements in quality of life within a few months or weeks, makes Vein Clinics of America a leader in its industry. We see hundreds of patients each month, only referred to care for their vein disease, and so we know how to treat the problem, what to expect, and how to avoid the complications. With all this experience behind us, it's no wonder that we can provide consistently great results and outcomes. We are always looking to improve the patient experience, so we regularly send out patient questionnaires and make the changes that patients expect, from ample parking to comfortable waiting areas, or shortening and simplifying the scheduling and billing process, as well as using other forms of communications for the patient reminder. The clinics meet all state and federal requirements, use electronic medical records for providing health records to patients and fellow physicians, while always remaining HIPAA compliant. But we don't stop caring for our patients after initial treatment. Vein disease is a chronically progressive process and requires regular follow-up. Why go through treatment just to end up with the same problem a few years down the road? This is why we regularly communicate with our patients and send out friendly reminders, so the patient will remain healthier for longer. We promote good venous health by providing our patients all the information they will need to combat progression of their venous disease. It's always a pleasure for me to see my patients after a few months or years and hear how great they're feeling and how happy they've been with their results. Nothing makes a doctor feel better than to know his or her patients are doing excellent. It's a pleasure to work at VCA, and it's clear that I and all the physicians at Vein Clinics of America share a common mission of providing the absolute best care in a comfortable and caring environment with superior results and outcomes. I want my patients to be at ease, knowing that they're being treated by someone with extensive experience and who can provide them with the highest quality of life.